The honorary degree will now be conferred. I'm pleased to welcome Dr. Angela Kaida to present the honorary degree candidate, Dr. Glenda Gray. Dr. Kaida is an assistant professor and a Tier 2 Canada Research Chair in the Faculty of Health Sciences. Dr. Kaida.
I'm going to raise this a little bit. Okay. Oh, here you are. Madam Chancellor, it is my distinct honor to present to you today Dr. Glenda Gray, one of the world's most visionary and preeminent HIV physicians and researchers. Her tireless dedication and outstanding contributions to the fight against HIV/AIDS have improved the lives of millions of people in her home country of South Africa and other global populations affected by HIV. Dr. Gray is the co-founder and executive director of the Perinatal HIV Research Unit, or the PHRU for short, which is one of Africa's leading HIV prevention and treatment research and clinical care centers. The PHRU is located in Soweto, South Africa, a region considered an epicenter of the global HIV pandemic. Under her visionary leadership, the world-class research being conducted at the PHRU has had wide-ranging influence on HIV-related policy and programming in South Africa and around the world, including right here in Canada. But Dr. Gray began her career as a pediatrician, and she worked in Soweto at one of the Southern Hemisphere's largest and busiest hospitals. And it was here that she developed a clinical and research interest in the prevention of mother-to-child transmission of HIV, which is known as PMTCT. This was in the early 1990s, a very tumultuous time in South African and global HIV politics. The virus was spreading quickly to devastating effect, and we knew that HIV could be passed from an infected mother to her baby, but we had very little in the way of tools to prevent transmission, and even less in the way of political will to act. But under Glenda's leadership and advocacy, the PHRU emerged as a pioneering international research site and a champion for the human and health rights of people living with HIV. Her efforts helped convince the local governments to invest in PMTCT programming, and leading to a tremendous reduction in transmission rates in South Africa, where thousands of babies are now born HIV-free. But Glenda's initial interests in pediatric HIV have now expanded to include HIV prevention and treatment, research in children, adults, adolescents, and thankfully she now brings her visionary leadership to cutting-edge studies in vaccine discovery, microbicide research, and other HIV prevention research that's focused on ending the devastation caused by this virus. And Dr. Gray has been hailed as one of the most influential and inspiring women in Africa. Her many prestigious awards include the 2002 Nelson Mandela Health and Human Rights Award for her outstanding work and dedication to improving the lives of women and children in Soweto. Glenda has a notable and enduring relationship with our university as both a colleague and a mentor. In a year when SFU has adopted a vision to be Canada's leading engaged university, we could not have selected a more inspiring representative of this vision than Dr. Glenda Gray. Madam Chancellor, on behalf of the Senate of this university, I ask that you now confer on Glenda Gray the degree of Doctor of Science, honoris causa.
Glenda Gray, by virtue of the authority vested in me and in the Senate of this university, I hereby admit you to the degree of Doctor of Science, honoris causa. Dr. Gray will be hooded by Dr. John Driver, Vice President Academic, and Dr. Tim Raleigh, Associate Vice President, Students.
It is with great pleasure that I now call on Dr. Glenda Gray for her convocation address. Dr. Gray.
Madam Chancellor, Mr. President, thank you very much. I'm deeply honored to be here in front of you and receive this wonderful honor of the Doctorate of Science. And I thank you, and I'm very touched and very hard to speak. In the last hour, 1,500 people in the developing world died from an infectious disease. Every single death can and should have been avoided, either by early detection or diagnosis, or by the deployment of cheap and effective vaccines, or by medical interventions that are largely affordable. We are not talking kidney transplants here, but cheap vaccines and generic drugs that are game changers in poor settings. Other game changers belong to the future, and you are our future game changers. You are our bright scientists and educators who will make history and improve the lots of people both in Canada and Africa. You who graduate today have the opportunity to change the game both in Canada and Africa. I have worked with many scientists at the Simon Fraser University, and together we have engaged communities and other scientists in Africa and in Canada. Simon Fraser University, you've seen the science, it's an engaging university where you engage scientists and you engage communities. And I'm imploring you to engage other communities beyond Canada and to dream the dream that's possible, that you can make anything you want to do. You are at the pinnacle of your career and you will have a great future. For us who live in Africa, research is a necessity and it's not a luxury. And we need young scientists and educators like you to work with fellow scientists and educators in Africa. It's very fitting that both the health faculty and the education faculty have their convocation together, because we need scientists to work with educators in order to improve the lives of people all over the world and bring solutions. For those young and potential students contemplating career in science, I quote Isidore Isaac Graeber, who was born in 1898. He was a US physicist and a Nobel Prize laureate in 1944. And he said, "Science is a great game. It is inspiring and refreshing, and the playing field is the universe itself. You will have fun, and you will do many things, and you will be able to do all this and change the game of the world that we know it." And as a pediatrician, I want to acknowledge how much science has helped me in my communities in South Africa. And as a pediatrician, I want to acknowledge all the children, my own children, who have sacrificed a lot of their time with me, the children who we have cared for, but who died before there was treatment for HIV, for the children who survived their disease, and those who escaped it because science changed their lives and science changed their future. My mother gave me a card when I came here to congratulate me on this wonderful honor. And I just want to quote something that she said in the card. She said, "It's not the mountain we conquer, but we conquer ourselves." And that's the challenge I give you. You have to conquer yourself, and you have to believe that you can do it, and the future will always be yours. Congratulations and well done.